Vaccine nationalism is turning the search for a COVID-19 cure into an arms race, which will ultimately damage the economy and public health, experts have warned. Analysts at Eurasia Group speculated that tension over a vaccine would heat up over the summer, predicting a battle for access that will stretch into 2021 or 2022. Countries rich and poor will engage in aggressive procurement efforts with significant political, economic and public health implications, they said in a note earlier this year. Existing international institutions and agreements will struggle to minimize this vaccine nationalism. The research group argued that some governments were already attempting to seize first access through large-scale investments. In the U.S., the Biomedical Advanced Research Development Authority (BARDA) has been spreading its investments across a number of vaccine candidates in an effort to reduce the financial risks for pharmaceutical firms and lock in priority access to a successful vaccine, the note's authors said. BARDA has financial interests in Moderna's candidate vaccine and has invested in early research being conducted by French firm Sanofi and Britain's GlaxoSmithKline. In May, the U.S. also invested $1 billion in AstraZeneca's potential vaccine, which is being developed by scientists at the University of Oxford. The British-Swedish pharmaceutical giant is aiming to produce 2 billion doses of the vaccine, with a view to roll 400 million doses out to the EU and UK by October. AstraZeneca's vaccine has also received multimillion-dollar investments from the EU government and $843 million payment from some EU countries, who have secured access to the vaccine should it prove to be effective. Meanwhile, the Canadian government's National Research Council has signed a deal with China's CanSino Biologics to manufacture its vaccine for clinical trials in Canada this summer, giving Canada an inside track on access, according to Eurasia's analysts. Ian Goldin, professor of Globalisation and Development at the University of Oxford and ex-vice president of the World Bank, also warned there would be consequences if countries attempted to make the distribution of a vaccine a national enterprise. Some competition is healthy. You don't want to put all your vaccine development eggs into one basket because it might not work, he said. But it shouldn't be that the country with the deepest pockets is able to protect its citizens but in poor countries people die. Goldin said failing to inoculate the global population against COVID-19 would have long-term economic implications. As long as some parts of the world are suffering from the coronavirus, the global economy can't recover, he explained. As long as it's present somewhere, the virus can mutate, it can move, and parts of the world economy will be devastated.